Hi everyone, Dr. Susan Brown. Today is week 2 of Osteoporosis Month. As you know, I like to call this Bone Strength Month. And I want to talk a bit about fracture risk assessment. How can you assess your likelihood of having a fracture? We have written a whole document on this. In fact, I have a whole quiz, a fracture risk assessment quiz on the betterbones.com website. You might try that out. But today I want to highlight some of the most important risk factors. If you have some of these factors, let's get motivated, let's get in gear, let's do something about them. One of the risk factors, of course, is if you've already experienced a low trauma fracture. Now, what is a low trauma fracture? That's a fracture that occurs from standing position. If I'm walking, I fall, break a wrist, that's considered a low trauma osteoporotic fracture. If you've already had a fracture, that's a sign of bone weakening, a sign that we should really do something to build stronger bones. Family history is also important. If your parents or your grandparents fractured a lot, or particularly if they fractured a hip, it's a very good idea to pay attention. There is some potentially important genetic link there. Then, of course, there's a series of all these nutrients. We know that vitamin D is absolutely essential. We know you can measure your vitamin D, and we want like a 50 to 60 Ng level. But now we know that 20 nutrients, everything from zinc, boron, manganese, copper, even the omega-3 fats, are extremely important for building bone strength. I'm going to be sharing little videos from time to time on each of these nutrients and the new pieces of research. But just in the meantime, you might look at our Nutrition Detective quiz, which lists about 20 or 30 common signs of nutrient deficiency. If you haven't done that quiz, do it, because it will help you see the likelihood that you have some significant nutrient deficiencies. Then, of course, there's the whole world of medicines that damage bone. As I've told you many times, 20% of all osteoporosis is due to the use of steroid medications like prednisone. Other medicines, many other medicines, also damage bone. Antidepressants, proton pump inhibitors, certain diabetic medications, many medications. And you can Google your meds and see the impact they have on bone. We always try to resolve the problem and realize when medications may be causing a problem for bone. Another important factor is weight. Actually, we don't tend to realize, but when you're beyond menopause, when you lose weight, you lose bone. And it's a little difficult to regain that bone back. So be careful with weight loss. If we want to lose weight, we do exercise, we build muscle, we burn fat, but we're careful because if we lose weight, we lose bone. And equally, a person who is of low weight, body weight is directly related to bone density. And that's because our current measures of bone density are influenced by bone size. A light person, a small person is going to have smaller bones. Those smaller bones actually are more vulnerable to fracture because, well, think about it. A chicken bone is easy to break, a cow bone is hard to break. The size of the bone is important. So people that are thin should take special care. Exactly, probably twice as many thin people fracture hips as people of an average weight. So be careful, be attentive if you are thin, and work not to lose weight. And we've had several videos on that. I'm happy to talk about it more, but many of us get a stress response. We don't eat, and then that can be damaging to bone. Another important aspect that you all know is activity. We must use our bones. We must put weight on our bones to show the body that it needs to have strong bones. And there is a direct link between muscle strength and bone strength. And this, in fact, is one of my most important contributions to help people see that bone density is one thing, but there's many other factors that even predict fracture much better. And one of those, to me, is muscle strength. When we say, I'm getting weaker, I'm losing muscle strength, we know we're also losing bone. So we want to do everything to keep the whole body strong and healthy. That's why we call it the Better Bones, Better Body program. Bone health is generally about total body strength. The last factor I want to talk about is pH balance. A chronic acid condition over the years can cause you to lose minerals from both bone and muscle to alkalize those acids. And we have produced a whole alkaline diet starter kit. It can tell you how to develop a very nutritious and delicious diet which will move the body away from excess acidity to a more proper alkaline pH balance. All in all, there's many factors that weaken bone. However, think about it, every animal in the forest has perfect bone health. We too should be entitled to that. And remember that bone weakening occurs, the weakening occurs because of usually multiple factors. I love this little camel illustration that shows you we get one straw on our camel's back, maybe inactivity, another straw, maybe smoking, another straw, maybe poor nutrition. All of these add up. But the important thing about this total load model is you don't have to correct everything. Sometimes you just lift one or two burdens and the camel is up to running around again and feeling much better. So don't be discouraged. Just pick one item at a time. Maybe today, being it Osteoporosis Strength Day, you think, well, let me see, what could I do? What could I do today? Can I do a bit more exercise? Can I have a little bit higher nutritious meal? Can I get those vegetables for lunch and dinner? Can I measure my pH if I haven't been doing it? Each step you take will make a difference to reduce your risk of fracture. We would like a world where there's no need